Am I still there?
Yeah, you are. You are.
Right. No, I've had to go to the bedroom. Washing machine's decided to get a bit noisy.
So, Tricia, thanks very much for coming on again this morning.
Oh, you're very welcome.
Stepping into the breach once again.
Due to circumstances beyond our control, I was hoping that I would have had a wee physiotherapy friend who would be more of the specialist in the area of managing breathlessness, but unfortunately she's unable to attend today. But she has left me very detailed notes. So I'm going to try and stick to the script. Can you imagine me sticking to any script, Tom? But I'm going to try my very best to stick to this script and tell you exactly what she would have told you. All being well, today we'll have a wee chat about managing breathlessness, coping and managing with breathlessness, which I know is probably one of the main issues most of you who attend this wee group would be dealing with. So I felt that it's important that you get the right advice. So as I say, my wee physio friend has left me very detailed notes. So I'll try and make sure we do it properly. But I will see if I can Hello, can you hear me?
Yes. Yeah.
Were you able to hear me? Have I been talking away to myself?
No, I can hear you.
Okay.
Oh no, you're fine.
Oh dear. Right, can everybody see that first wee slide?
Yes.
Yep.
Yes.
Okay. So today we're going to spend some time looking at breathing easy and coping with and managing breathlessness. Now, if I get stuck on big words, you'll probably be able to help me out because you probably know more about this than I do. But we'll see how we get on. So, as I say, my wee physio colleague should have been doing this, but she's not able to be here today. So, breathlessness. So, what is breathlessness? Well, it's often described as that awful intense tightening in your chest or feeling like air hungry or like a feeling of suffocation. The medical term for breathlessness is this word at the bottom here, dyspnea. You don't pronounce the P. Dys meaning something that's difficult, and pnea meaning breathing. So you'll hear about people that have sleep apnea. You've maybe heard of that word. And sleep apnea basically is when A means without. So if you've got sleep apnea, there are times during the night that you actually stop breathing. And that's why you'll find people with sleep apnea will go on like CPAP machines and things like that. But dyspnea is difficulty with your breathing. And that would be the medical term. So if you ever see this written down anywhere, dyspnea just means breathlessness or shortness of breath. That's exactly what that word means. So I'm sure most of people who are on the call today would say that they have suffered breathlessness at some stage in their condition because it's probably one of the first things that you noticed before you even went to be diagnosed was maybe that difficulty catching your breath. Would that be fair to say? Would everybody?
Yes.
Yeah. So it's probably the one thing that took you to the doctor. And so it's one of those things that we can't necessarily take away the symptoms of breathlessness, but we can help to learn how to manage. That's why we talk about managing these symptoms. So getting out of breath is something that's very normal. Even the fittest person, even the people that runs all the races and everything gets out of breath and gets that feeling of breathlessness. It's a natural response that your body goes into when it needs maybe more oxygen and when you're using more energy. But some people find they get out of breath when they're not even physically exerting themselves. and they find it difficult to breathe. And this sort of long-term breathlessness is known as chronic breathlessness. And that would be one of the symptoms of IPF, is this feeling of chronic breathlessness. So what are the causes? Why do you feel breathless? Well, obviously lung conditions, but things like asthma, pulmonary fibrosis, COPD. And unfortunately, just because you have maybe pulmonary fibrosis doesn't mean that you don't get other things as well. And those other things then that can happen can make the problems that you're having with breathing feel even worse. So if you have maybe a chest infection, then that can affect your breathing. If you are feeling a wee bit weaker, if you haven't maybe been exercising as much because of your breathlessness, then your muscles become deconditioned. Pain, if you've got pain in your lungs or in your chest wall, that can affect how deeply you breathe in and how much oxygen you're getting in. Smoking is obviously going to affect the levels of oxygen in your blood. Being anxious, you can get cancer, obviously, of your lungs, and cancer treatments can cause breathlessness. You can get blood clots. You can get a buildup of fluid in the lungs, and they'd call that pulmonary edema. Have you heard of that term? If you ever hear of a term, pulmonary edema, it's talking about fluid on your lungs, and sometimes that can be caused by an infection, or sometimes it can be a wee indication that there's a problem with your heart. And you've maybe heard the term heart failure. And with heart failure, you would maybe get a buildup of fluid on your lungs. So different heart conditions can cause breathlessness, conditions in how the actual muscles work. So diseases like motor neuron disease and MS, all those kind of neurological diseases can cause breathlessness. Funnily enough, kidney disease and thyroid disease. And I suffer from a problem with my thyroid, and I would get out of breath as well because of my thyroid. And then if your blood's low, if you're anemic, there's just not enough oxygen getting around your body. So your body's working harder to get the oxygen in. So low levels of red blood cells is also going to cause breathlessness. So there's lots and lots of reasons why you might be breathless. Primarily, obviously, for yourselves, the main reason would be the condition. But I think understanding that any of these other things could be going on as well. So what I suppose would be important to remember is that if your breathlessness changes significantly, or you feel that it's different than it normally is, then you might want to go back to the GP and get things checked out, because just because of the IPF, it doesn't necessarily mean you won't maybe have problems in some of these other areas as well. So if there's any change or difference in your level of breathlessness, go and see your doctor. Is that all okay?
Yeah.
Is that all right?
Yes. Yes.
So we're going to have a look at the lungs. This is where my colleague would know a whole lot better than me and can pronounce all these big words. But this is a wee diagram of your lungs, and you've maybe seen this when you've been to the doctor, or you've been, if for any of your checkups or anything, the doctor has maybe shown you this picture. So the diaphragm and the muscles between your ribs. So the diaphragm is that big, sort of half moon shaped muscle. It's underneath your lungs and beneath your heart. So your diaphragm, that's a big muscle inside, and then the muscles around your chest wall and between your ribs, they basically contract and then relax in order to get air in and out and in and out of your lungs. So they're the main muscles that you use when you're relaxed. And you can see, you probably know all this, the outline of your lungs there. Your lungs are full of all these wee branches. It's like trees in your lungs, and all these wee branches go off into other wee branches. And that's where all the oxygen is taken up by these wee alveoli. and that's how your cells get oxygenated. Okay. So it's like an upside down tree. I'm going to read what my physio friend actually wrote because she knows what she's talking about. When you breathe in or inhale, breathe in just for me now. Your diaphragm contracts or tightens and moves downwards. And this increases the space in your chest cavity. And then your lungs expand. And the muscles in between your ribs also enlarge in the chest cavity. So they contract to pull your rib cage both up and out when you inhale. So you can see that when you breathe in. You can see the changes that happen in your body when you breathe in. And as your lungs expand, the air is sucked in through your nose or your mouth. The air travels down your windpipe and into your lungs. And after passing through the bronchial tubes, the air finally reaches and enters the alveoli, and they're like the wee air sacs. And through the very thin walls of these wee duty alveoli, the oxygen passes from the alveoli through to the blood vessels. So that's how it all works. So all those wee tiny wee bubbles at the end of like the leaves on the trees, those are your alveoli, and that's what does all the work of getting the oxygen into the blood. All right, you still with me?
Yes.
All right. At the
Yeah.
same time, then, when you breathe out, what do you breathe out?
Carbon dioxide.
Yeah, that's exactly right. So you breathe out carbon dioxide, and that's like the waste gas. That's like the gas that's been the air that you've breathed in has been filtered and all the oxygen taken out of it, and then you breathe out carbon dioxide, which is like a waste gas. Okay. Now what do I say? So in pulmonary fibrosis, there's changes obviously that happen to your breathing. So if you have pulmonary fibrosis, then there's scarring that's happening in the air sacs in your lungs. So where before you were ill, your air sacs were nice and fluffy, and the air was able to pass easily out from the air sac into the bloodstream. Because of this scarring, your lungs are less able to expand and allow you to take deep breaths, and the level of oxygen in your blood can start to drop, and breathing feels like harder work, and you can feel breathless from just doing everyday things. All right. Does that make sense? Not everybody understands why their breathing is affected the way it is. Okay. So whenever we are struggling to breathe, we can start to use other muscles. The muscles that are meant to help us to breathe are those ones around our ribs and that big muscle in our diaphragm. But what happens whenever we're starting to get a wee bit out of breath is we start to incorporate a lot of other what's called accessory muscles. So that's your upper chest, your neck, and your shoulders. So do you ever find when you're a wee bit more out of breath, you start your muscles start to hunch up? You breathe like this, and it's the shoulders get sore and the neck, and this is not effective over long periods of time, and you get very, very tired very easily. Okay. So what are we going to do? How are we going to manage? How do we manage this breathlessness? Well, there's lots of different coping strategies that hopefully we're going to be able to talk through today. So the different coping strategies are learning to control your breathing, looking at positions of ease. In other words, positions you can put yourself into that makes it easier for the air to get in and out of your lungs. Using a wee handheld fan, and we are very grateful to yourselves in Pulmonary Fibrosis NI. You have supplied us with a lot of wee handheld fans in the past, which we use with our patients here in the Northern Ireland Hospice, and it's very much appreciated. But we'll talk about the wee handheld fans. We'll talk about managing anxiety and panic, because as we saw earlier on, when we get anxious or when we start to panic, maybe it makes the feelings of breathlessness worse. and it makes the perception of lack of breath worse. So it's really important that we learn how to manage, and it's probably more important that we recognize anxiety and then be able to do something about it. And one of the things you can do about it is obviously relaxation. And then there's lots of medicines that can be used that can help us with breathlessness. So we're going to look at each of these different coping strategies individually. So the first one we're going to look at is breathing control, and we're going to try some diaphragmatic breathing. So we're going to do this, start at the top at this wee box here and do a wee bit of diaphragmatic breathing. So I want you to sit back in your chair and relax. Make sure you're well supported. Make sure your 2 feet are on the ground and your hands are supported on your knee. Try and relax your shoulders. Do you find your shoulders sometimes hunch up? Try and relax those shoulders. Give them a wee shimmy. Relax your shoulders and that upper part of your chest. And just put your hand on your tummy. And breathe in through your nose. Feel your tummy rise up. That's your diaphragm contracting. And then breathe out through your mouth. And feel your tummy going down. And that's your diaphragm relaxing. And remember, we talked before about the breathing. We should always try and breathe out for twice as long as we breathe in. I think most of you were on the wee talk that we did about managing anxiety and relaxation. It doesn't matter how many you count for, if you count for 1 or 2 or whatever, but you should always try to breathe out that bit longer than you breathe in, twice as long as you breathe in. So if you breathe in for 1, it would be out for 2. 1, 2. You breathe in for 2, then breathe out for 4. 1, 2, 3, 4. Okay. So this type of breathing involves using your diaphragm and these lower chest muscles to breathe instead of this upper part of your chest and your shoulder muscles. Because when you breathe like that, you're not getting that oxygen right down into the base of your lungs. And that can become very, very tiring. That kind of breathing will actually tire you out very quickly. So it's really important that you try and control your breathing. So breathing control is sometimes known as relaxed tummy breathing. And there's 3 R's to our relaxed tummy breathing. There's the rise of the tummy as you breathe in. There's relax as you breathe out. And there's rest and wait for the next breath to come. Okay? So 3 R's. Rise, relax, rest. Okay, that's diaphragmatic breathing, and that's a form of breathing control. Okay, so the next thing we're going to have a wee look at is positions of ease. Now, you might already know what positions suit you better whenever you're starting to feel a wee bit out of breath. But some of these might help. So sitting or leaning forward with your elbows resting on your knees and making your hands and your wrists go limp. Some people find that is a good position to try and get more air in. Or sitting upright against the back of a firm chair, making sure that you're well supported in a good chair with your arms on the chair arms or on your thighs. And again, relaxing your arms and making sure your 2 feet are on the ground. Or sometimes sitting or leaning forward at a table, maybe with a few pillows or something on it. I can remember a wee gentleman that we looked after here, and he actually found it more comfortable to stand with, he had a hospital table that would have been up quite high and a couple of pillows on top. and he would have stood and rested his elbows on the table and stood, and that's the position that he found most comfortable to breathe. And he would have stood like that for hours, actually. So a bit like the wee man in the corner there, leaning on the windowsill. This wee man would have found that quite a comfortable position to breathe. If you're getting out of breath and you're feeling and you're not near a chair, the picture on the other side of that there with the man leaning up against the wall, if you find you're getting out of breath and you've no chair to go to, if you find a wall and make sure that your full back is supported by the wall, your 2 feet on the ground, your shoulders nice and loose, and your hands down and your head down, that is a position that might give you a wee bit of ease in order to get back to controlling your breathing if you don't have a chair about or whatever. And then the other position there that you can see down in the other corner is the guy with all the pillows. Now you can use lots of pillows. I'm sure most people here find it difficult to lie flat, maybe completely flat in the bed. It's very difficult to be able to breathe properly when you're lying completely flat. So sitting that wee bit more upright gives a wee bit more support to those muscles, and you can breathe a wee bit better. So you can either do what that guy there is doing in the picture and use all the pillows, or you might have one of these fancy beds that can come up and bring you into a sort of a seated position. Or you can get wedges. I don't know if you've heard of these. You can get a wedge to put underneath your own pillow, and the wedge will sit at it's like a ski slope, like at a 45-degree angle. And you can put that under your pillow, and then that's raising you up another wee bit. And you can get pillow wedges from the likes of your OT, or you can purchase them from any of the online places that would sell sort of equipment and things for disabled people. So it's important that you find whatever it is that is appropriate to yourself, that you find a position that you find it gives you ease and helps you. Not everybody will feel the same. It's really important that we know we're all individuals and we'll all find something different. Okay. What do people do mainly? How do people sleep with a whole lot of cushions or pillows, or what do you do?
I sleep with 3 pillows.
Right, aye. And the nice firm pillows?
No, not overly for I on my back.
Oh, do you lie on your back?
I do,
Right.
and it's great. I've no problem breathing
Brilliant.
through the night.
Some are using wedges as well, Trish.
Yep.
Una uses one.
And you can get these things nowadays, body pillows. Have you seen the body pillows? And they go the height of a man. And you can either prop them up against as you're lying, or you can, the way you could put them underneath your arms so that you can prop your arms up when you're lying sleeping, or you can use them. Remember, ladies, maybe when you were feeding the baby, we would have had like a V pillow. You can get those sorts of pillows. So there's lots and lots of different shapes and types of pillows that can be useful. Okay. So that's positions of ease. And now we're going to talk about the wee handheld fan. So there is actually scientific literature out there to show that a handheld fan is actually an effective way of helping with the ease of breathlessness. So there's been studies and things done, and just that even the sort of sensation of the air at your face actually helps with that sensation of breathlessness. So a wee handheld fan is really, really useful. And as I say, Tom has been very good to us, and we've got fans in the past, and you probably all have your own wee fans. You can get ones that are rechargeable, which is brilliant because it means you're not going to go through a whole lot of batteries. And you can get ones where you can, I think the ones that Tom gave us, there's wee settings on them. You can make it go faster or slow. And I have to say, for ladies of a certain age, if you know what I mean, it's very handy having a wee fan like that as well. I quite appreciate. I have a fan in every room in the house, even at the minute, even in the cold. I still have the fan because as I say, I'm just that certain age. So a wee handheld fan is a great thing, and the best position to hold it in, if you're talking old money, about 6 inches from your face or 15 centimeters. So half a ruler, if you've got a ruler, I happen to have a wee ruler here. So half a ruler is where you would hold your handheld fan. So about here. So fairly close to your face. But just watch if it's one of those ones that doesn't have a wee guard on it, and you have maybe longer hair, ladies and gentlemen, you maybe need to watch you don't get your hair stuck in the fan, because that has happened to children that I know. So you just need to be careful. But you need to aim the draft of the air towards the central part of your face so that you feel the draft around the sides of your nose and above your top lip, and hold it there for a few minutes. And you can use that all day, every day, if you want, but you can use it for as long as you need to help control your breathlessness. Other options might be, or as well as even your handheld fan, you could sit in front of an open window, just getting the breeze or the draft through the window. Making sure that you're in an uncluttered environment. Maybe somewhere that's not too, you need to be aware of things like even dust and things like that, stuff in the air. Would be advising if anybody with any breathlessness condition, we would be advising not to use things like open fires. Because it's not the fire itself that it is the problem, but it's maybe cleaning out the fire afterwards, bringing the coal in and the dust that it creates, etc. All of those environmental things can actually make worse your feelings of breathlessness and can catch your chest. So things like keeping a really good dust-free environment, having wooden floors and things like that to help with the level of dust, and getting somebody to dust when you're not in the room. This is something I myself have asthma, and unfortunately it means I can't dust. Isn't that a terrible shame? So my husband has to do all the dusting in the house, but I can't even be in the room when he's dusting. I have to go up the stairs because when the dust starts to circulate, it would start to go for my chest. So be aware of things like that as well. Don't be letting anybody rake out or clean the fire when you're in the room. Go to another room and wait maybe half an hour after the fire has been cleaned out before you would go in, because the debris from the fire could still be hanging in the air. So just even simple practical things like that. Just being aware of your environment. Um, and if you've nobody to come in and do the dusting for you, um, a mist spray, even on your surfaces, but also on your face. Whenever we were in Disney World, my kids played me to get these fans, and actually in the end, I used them more than the kids did. They were like a fan with a water bottle attached, and when you pressed the button on the fan went round, but it also blew nice cold water around your face. And in America, that was fantastic. And I think you can get something similar. Ladies, you can buy the wee nice sprays like Evian and all the rest of it. And it's water. At the end of the day, it's water. And if you have one of these wee fans that's attached to the water bottle, that's exactly the same as buying these real fancy sprays and things that you can douse yourself with. And quite importantly too, wearing clothes you're not feeling hemmed in. So men maybe not having buttoned up shirts and too clothes that are too tight, because that's obviously going to affect even the sensation of, your muscles moving to get the air in. So trying to use nice unrestrictive clothing. All right. So the next thing then is learning how to control that anxiety and panic. And we're back to many times have you seen this square, this rectangle? I think every single time I talk to you about anything, we look at this wee square, this wee triangle. So because I'll see all the faces and they're all very familiar faces that I can see on the call today. So you all know about this wee breathing rectangle or breathing square. And it's a distraction. It's something to help you. It's basically, there's nothing magical about it, but focusing on the square or the shape and breathing around that square or shape or rectangle is just taking the focus off your head and your worries and your panic and making you focus on something else. And it helps to distract you from what's going on. Because I think what happens is whenever you maybe start to get a wee bit breathless, it can trigger that anxiety that you sort of worry, I don't know if I'm going to get another breath. And I'm getting out of breath, I'm getting out of breath. And you think, I'm not getting enough oxygen. And that feeling and those thoughts actually make the breathlessness worse. So if we can recognize, and I think this is the most important thing to remember, if you can recognize that it's anxiety that's causing the breathlessness maybe to get worse, then you can hopefully bring in one of your wee strategies to try and help. But the strategies will only help if you're able to recognize that you're getting a bit anxious. And that takes practice. That takes awareness and knowing yourself and understanding yourself. So it's just one of those things, you need to maybe practice. And I think I've said this to you before, practice in the good times what you might need in the bad times. So practicing the breathing control when you're feeling not too bad, so that whenever you do, God forbid, have a wee episode where you're feeling poorly, it comes more second nature to you. So practicing that nice deep breathing, the breathing in for 1, out for 2, in for 2, out for 4. Practicing that so that it's second nature to you will mean that if you do, as I say, God forbid, start to feel a wee bit more anxious, it comes more naturally to you to do that type of breathing. Some people find, you may be wondering what on earth is there a picture of elastic bands there. Anybody use elastic bands to help with their breathing? Anybody ever talk to you about using elastic bands?
No.
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 No. Some people find whenever they're starting to maybe get a wee bit panicky or a wee bit anxious, that they have an elastic band around their wrist. It could be an elastic band or a bauble or whatever, but just plucking at it. And it's just a distraction. It's designed to take you out of your own head and sort of snap you back into reality, if you like. The very physical thing of snapping the elastic band and it sort of snapping back on your skin, it sort of takes you out of that thinking that you're panic and sort of grounds you back into reality again. It doesn't work for everybody. It's one of those things. It works for some people, it doesn't work for others. But it's something that maybe, there's no harm in giving it a go and giving it a try. But it's a reminder to try and not overthink and get over anxious about things and prevent the anxiety from getting worse. Okay. And other things that we might use is the calming hand. And I don't know if you've ever seen this before, where you use it, because most people have got 2 hands or at least 1 hand. And so this wee calming hand is basically just used to help you. It's like the square. It's just something that's handy to have that you can look at your hand and go, look at your thumb and say, yeah, I'm starting to get a wee bit out of breath. So you trace, I would use my finger to trace around my hand. Can you see this? I would use my finger to trace around my hand like this. You see? And what you're doing is you're saying with your thumb, I'm starting to get a bit anxious. And then you're going to your next thing and you're saying out. You're breathing in. You're breathing out. And then you're stretching out your hand and trying to relax. Again, it's something to take your mind off, focusing your brain and focusing your thoughts on something different than focusing on the fact that you're struggling to breathe. And if your breathing is being exacerbated by anxiety, then these sort of wee things will help. Okay? So relaxation. If anybody was at the wee talk we did last month, we tried lots of different wee types of relaxation. So I think we tried about 4 or 5 different forms of relaxation. And relaxation methods can be learnt successfully to help you reduce the tension in your body and help you to breathe more easily. And there's lots and lots of CDs and web places and all the rest of it. There is actually a CD that is produced by Macmillan. Now, obviously, Macmillan are producing it for people with cancer-related breathlessness, but it's all the same mechanisms, all the same difficulties that people with cancer-related breathlessness will have is exactly the same for yourselves. So Macmillan have a booklet and a CD that's attached to it called Relax and Breathe. And if you go onto the Macmillan website and just look up leaflets, you'll be able to, you can either download the leaflet and stuff, or they'll send it out to you. And if you are asking as a patient, they'll post it out to you for free. So that's a useful wee thing to have. So it's called Relax and Breathe, and it's by Macmillan. So that the cancer people, Macmillan. So it's relaxation we talked about, as I say, last month. It's a very useful thing to have in your wee toolkit of things to use when you're starting to get a bit more breathless. It needs practice, and you need to set yourself time aside to do it, and it takes a wee bit of time to master it. And you can use all sorts of different techniques and websites and all the rest of it to do that. And as I say, if you were with us last month, you got to try a couple of those different wee types of relaxation. Now, medicines. So you are probably the experts on this part of all the different types of medicines that you can take that can help with the breathlessness. So a low dose morphine can be used, or Oromorph, if you've heard of that. So the morphine is a depressant that it actually if you take too much morphine, it can actually affect your breathing. But it does something. I need to read the book here. But the morphine works in a sort of counterintuitive way to help with the breathing. I think it relaxes the muscles and helps you to sort of breathe in more easily. But it's one of those kind of you kind of think it's counterintuitive. You can get bronchodilator drugs, and that's what would be in the likes of your inhalers, and they would be either nebulized, so you might have a wee nebulizer, a wee machine that sort of disperses the medication through mixed in with sort of like a light sort of air with water, or you can use them just in a spacer, or just some people put them straight. I have to use a spacer for my what do you call it? Can't remember what they're called now. Inhalers.
Inhaling.
Inhalers. Think of the word. I don't think of the word. Oh dear. Salt water can be useful. We again we you would have used this maybe ladies you would whenever babies would have been very congested. You would have maybe used a wee bit of salt water and a wee pipette up their wee nose to try and it sort of dries things out a wee bit if you're feeling very congested. And maybe that's why maybe if you've got a nebulizer, they would give you a saline neb. Maybe you've heard of that, a saline neb. And that's just salt water and it's based on the same principles that it kind of dries up secretions and things like that. Corticosteroids. So steroids help with inflammation. So you might be put on a wee course of steroids to help with inflammation. You might be given anxiolytic. Anxiolytic just means an anti-anxiety drug. So you might be prescribed anti-anxiety drugs or drugs that maybe help you feel a wee bit more calm. So things like lorazepam and diazepam. Sometimes they find that antidepressants are useful. And for some people, and particularly yourselves, oxygen is useful. All right. And then there's managing things yourself. And when we talk about self-management, we talk about the 3 Ps. The adjustment strategies are the 3 Ps. So the 3 Ps are plan, prioritize, and she hasn't written down the other thing. I can't remember the other P. Pace, that's the other P. You see, this is what happens when you tell somebody you'll do a talk for them and you only do it with like 5 minutes notice. Sorry, I would have been, if I'd known before today that I was doing this, I would have been slightly more prepared. Yes, the 3 Ps are prioritizing, planning, and pacing. And that's all to do with whenever we do any kind of activity, making sure that we plan well, that we only do the things that are important and we prioritize and that we pace ourselves. And then sometimes it's maybe useful to use any kind of equipment or aids. So we'll get on to those. It's actually probably further on in this slide show. So physical activity. Do you remember we talked about exercise a couple of months ago? We talked about exercise and diet. So muscles that help breathing can become weak because of fatigue, or if we're not eating properly, or if we've lost weight, or if we haven't been keeping up our physical activity. And even people with very severe breathing difficulties can benefit from a small amount of physical exercise. And we talked about this a couple of months ago when we talked about the exercise and activity. It's important to start slowly and use your controlled breathing and improve your levels of fitness and gain your confidence. You can go to, I think we talked about on that day about pulmonary rehab, and that's a specific treatment program that's run by the NHS, which you may have already been involved in. But the pulmonary rehab program is a specific physical exercise program designed for people with lung conditions, and it's tailored specifically for you. And it will give you information on looking after your body and your lungs, and it'll give you advice on managing your condition and your symptoms. So pulmonary rehab can help to improve your muscle strength so you can use the oxygen you breathe more efficiently and become less breathless. It can help you cope better with feeling out of breath. It can help improve your fitness so you feel more confident to do everyday tasks. It helps you feel better mentally, and it helps you understand and manage your condition better. You may have been offered pulmonary rehab at some stage in your journey, and maybe you've done pulmonary rehab before. If you haven't, or you think it would be something that would be useful, I would recommend you speak to your respiratory nurse, the specialist respiratory nurse, or even just speak to your GP and ask if your trust, where your trust hold the pulmonary rehab classes. I would like to think that most pulmonary rehab classes could possibly be hybrid. In other words, they would maybe be done using the likes of what we're doing now, the likes of Zoom, as well as maybe offering people to come into an actual physical space to do this. But to me, it would make sense that pulmonary rehab would be offered in a virtual setting as well. But if you've any difficulty finding out information about pulmonary rehab, let Tom know, and I'll try and find out a wee bit more about it. But there should be, within the areas that you are in, there should be pulmonary rehab on offer. All right. So the Borg scale, have you heard of this? Have you
No,
ever been to the physio and the physio does your Borg scale, or you're asked to rate how breathless you're feeling? It's basically just a wee tool that's used by healthcare professionals to enable people to score their breathing. Maybe you've been in hospital and they've asked you to rate your pain, and you rate your pain on a scale of not being no pain and 10 being the worst pain ever. You've maybe heard that scale being used. This is something similar, but it's used to help people to put a score, or just to measure how breathless they're feeling. So the Borg scale, similar to the pain scale, starts at naught if you've no breathlessness at all, right up to 10 when you're feeling very, very breathless. You can hardly catch a breath. And basically anything above a 6 is going to be something that needs intervention for. Okay. So the talk test during an aerobic activity is a quick way to check if you're working out at the right level for you. So if you're doing something and you're getting out of breath, but if you are able to say out loud, "This activity is doing me good." If you can say that sentence, then you're okay. You're just out of breath normally and within the limits of your exercise tolerance. If you can say the sentence with 1 or 2 stops for breath, you're working at a moderate intensity, and that's okay. If you can't speak or can't say more than one word at a time, then you need to slow down and you need to stop and you need to do your breathing exercises. So does that make sense to everybody? So when you're doing something a wee bit more active, if you're able to say to yourself, you're out for a wee walk, but you're able to say to yourself, "This activity is doing me good." If you can get that sentence out just with a couple of breaths in, but taking a couple of breaths in between, you're doing okay. You're doing okay. But if you have to take a breath between each word, then you need to slow down, you need to stop, you need to control your breathing. So I hope that's helpful. And this Borg scale is basically, as I say, it's just a measure of how out of breath you're feeling. And anything above that 5, that's where we don't really want to be. We don't really want to get into that territory when you're doing your exercises, or you're doing your walking, or you're doing your chair aerobics, you're sitting in your chair doing your exercises or whatever. Okay. Well, these are the 3 Ps. Thankfully, I remembered them eventually. So these are adjustment strategies for the everyday. So the 3 Ps, prioritize. So in your day, there may be 2 or 3 things that maybe need to be done. And sometimes when you're feeling a wee bit more unwell, maybe you're getting a cold or something, you're just not feeling up to yourself. Maybe you need to say to yourself, well, what's the most important thing? What's really necessary? And what is the most important thing to me? Sometimes the most important thing to you might not be the most important thing to somebody else. And what's important to you might be, and I think we've talked about this before, might be important for you to be able to spend time with the grandchildren or go out for a wee cup of coffee. It might be important to you to be able to go to the bowls or to do nice things. But what might be important to somebody else might be being able to get out into the garden and doing a bit of gardening. So it's all very individual. So you need to think for yourself. In my day, what is the most important thing for me to get done today? And make that your priority, make that your focus. And if there's other things that need done, well, then maybe that's the time to ask somebody else to give you a hand or ask somebody else to do it. I love asking somebody else to do me ironing and things like that. People come and say, can I do anything for you? Yes, I have a big pile of ironing in there. You can do that for me. So I think I've told you this before. Always have a wee list of jobs that other people can do. And when people come to the house, you know the way they will, people will come to visit you and they'll say, if there's ever anything I can do for you, and you have a wee list ready, and you say, yes, I have a pile of ironing there you could do, or I have a pile of washing out in the line, you could go out and get it and bring it in for us, or you could put my bin out for me. Always have a wee backup list of things that you can get other people to do for you so that you can prioritize your time and your breath and your energy for doing the things that are important to you. And planning then is important whenever you've got limited energy and you maybe get out of breath. It's really important to plan activities, organize tasks to make them easier, and also don't try and have too many things happening on the one day. So if you have a hospital appointment, you make sure that there is nothing else happening that day. You don't plan to look after your grandchildren, or you don't plan to have an appointment with somebody else. One big thing in the day is enough. Put things off to another date and plan things so that you're not wrecking yourself in one day doing too many things. And pacing yourself. And we talked about doing the wee activity and being able to say, this activity is doing me good. If you're not able to say that, then you need to stop, take a break, have a cup of tea, sit down, do your wee breathing exercises, watch something stupid on the TV, and then get back up and do the rest of the activity. Here's the thing we need to learn. You don't have to get everything all done at once. It doesn't matter if you've only half the washing in the washing machine. The other half can go in half an hour. That's fine. It doesn't matter if your potatoes are only half peeled. The potatoes will sit there and wait for another 15, 20 minutes until you're feeling more like it, and you can go back to them. And the tea might be 15 minutes late. Big deal. Big deal if the tea's 15 minutes late. It's better that you are all in one piece and able to breathe well and looking after yourself than the tea maybe being at the right time. Isn't that right? So it's making adjustments for every day. And sometimes people will find that wee bits and pieces of equipment might help. We're actually going to be having a talk specifically on different types of equipment and how it might help you. But this is just a wee selection of things that can help with managing breathlessness. So you'll see in the four corners are like walking aids, things to help with your mobility. And it might not be that you're particularly maybe unsteady on your feet, but we talked about those positions of ease and being able to stop and rest if we need to. And particularly see the one down in the bottom corner, the wee four-wheeled walker. And it's got a nice wee seat on it. And it's got, I love it because it's got a wee basket for your pruck. Now, I've said the word pruck to people in here and they look at me and they don't know what I'm talking about. Who knows what pruck is?
Yeah.
Aye.
Nope.
Where do you live? Do you mind me asking? You in County Antrim?
Who's that? Me?
Desi?
Yeah, I'm in Ballymena.
Ballymena. You see,
And
I
know what
think
Pruck is.
pruck must be like Ulster Scots or something, because my granny used to talk about your pruck. And I'll say to people, you can put your pruck in it, and they're like, what is that? What are you talking about? Is there anybody doesn't know what we're talking about?
Me, I've heard of the word, but I don't know what you mean in this.
Just, do you know all the stuff that you have in your handbag?
Your bits and pieces.
In other words, a load of rubbish.
A load of rubbish, aye.
Ah.
That's your pruck. That's your
Yeah.
pruck. So you can stick all your pruck in the wee basket there. All your wee bits and pieces. All the wee necessaries. Why we have these handbags that are like mini suitcases. I don't know what we ladies are preparing for. We have all this stuff with trail around
I
with us.
I very rarely use a handbag. I have pockets in my trousers or jackets or coats or whatever
That's
for to
what,
put my phone in and whatever else in the other pocket.
yeah. Well, that's,
That's
well,
all I need.
men tend to have everything in their pockets, and
Yeah.
women tend to have everything in their bag. I could have pulled, it was like a magician's hat. I could have took stuff out of my handbag. I would have had coloring pens and coloring books and sweets and all sorts of things because with the kids, you always had to be prepared. But
I only use.
that's a great wee thing there, that wee four-wheeled walker. As I say, you might only need it to use it if you're outside, if you're going out for a walk or you're maybe going around one of the shopping centres, but you want to stay on your feet. It's a great wee thing because you've always got a chair with you. You've always got somewhere to sit down and stop and rest. So I think that's a magic wee thing there. The other the other one up in the top corner there, that's called a delta rollator. It's called a delta rollator because a delta is like a triangle. It's one of the Greek letters of the alphabet, and delta is like a triangle shape. So because this has got three wheels, it's called a delta rollator, and it has a lovely wee bag, and you can put your pruck in that wee bag as well.
Yeah,
And
we'll have one of them
you
for
need
him.
to get pruck put in it.
Mm.
And then the other one in the other corner is called a wheeled Zimmer. You might have seen Zimmers that don't have wheels. You can get them as well. Thing with the ones that don't have wheels is you sort of have to lift them
Mm.
when you're walking along. But the wee wheeled Zimmers you can actually just push along, and I find that people find them much easier to use. And then the other bits of equipment in the middle, we've got a wee trolley here, which I think is a brilliant wee thing. You can you can make a cup of tea, and you can make a cup of tea for your friend, and you can put a plate of biscuits on the trolley and then wheel it in, and then you're not having to go in and out and in and out and in and out to the kitchen a whole lot of times to
Mm.
bring all your bits and pieces in. Or you can put your crossword book or the TV Times or whatever you like, whatever you need, your TV remote, your mobile phone. You can put whatever you like on this trolley, and it means you can wheel it about wherever you are. And it also acts as a kind of a walking aid. It helps to sort of steady you on your feet as well. And then you've got this thing at the very bottom in the middle. That's not a litter picker. As many of you might think that that's a litter picker, it is not a litter picker. This is a long-handled reacher, and we would recommend sometimes that people use these if if you find when you bend over that you get more breathless. We find that advising people to use these means you can pick stuff, small stuff. If you drop something on the floor and you struggle to bend down to pick it up, you can use this wee grabber thing to pick it up, like a tissue or a book or a bottle of tablets. Small things you can lift with this. There's a wee magnet in the end of it as well, so that if you do drop something that's metallic, it'll pick it up. It'll pick it up with the magnet. Then this long, skinny yellow thing, does anybody know what that is?
Nope.
Oh,
It's a shoehorn. Do you ever remember ever using a shoehorn? How many of us struggle to get the back of the shoes on? And again, it's that bending over and footering to get the back of the shoe on. And what you do with this shoehorn is you pop it in the back of your shoe and you slide your foot along it and your foot goes into the shoe much easier and none of that old footering trying to get the back of the shoe up. And do you know what I mean? When you're putting on like trainers or flat shoes or whatever, this saves you having to do all that footering with the trainers. And then you can see on the stairs there, then there's a wee rail. Now, everybody should have at least one rail on their stairs. But what we would recommend is that if you have stairs and you do get a wee bit out of puff, that you have a rail on both sides. And then it means you can stop holding on to both rails, get your breath, keep yourself steady, and then keep going on up the stairs. All of these pieces of equipment, the bigger bits, the smaller bits, I'll talk to you about in a minute. All of these things around the outside of the picture, you should be able to get all of those through your community OT or your community physiotherapist. And if you feel you need any of these, go to your GP and ask your GP to refer you to the community OT in your area or the community physiotherapist. The smaller aids in the middle, the shoehorn and the long-handled reacher, depending on where you live, the OT may provide these. Budgets being what they are nowadays, there are some areas that are asking people to purchase these independently, these smaller bits of equipment. In my day, when I was training, we would have given these out to people, but I think some of the trusts nowadays ask you to pay for them. But you can get these online, you can get them on Amazon, you can get them sometimes you can get them in the likes of Home Bargains or B&M. You just need to keep your eye out. They tend to have them, and Boots, sometimes Boots the chemist will have like a wee section of equipment, and you might get wee bits and pieces like this as well. So there we go. And that's us. There we go. There. I got through it.
Well done.
I know.
Very good.
I have to say, I apologize. I apologize for my hemming and hawing and that. I say it sort of took me by surprise. About 10 minutes before it came on, I realized I was going to be doing this. So I apologize for not being better prepared. I hope that you got something out of that, despite me maybe rambling on a bit.
Very good.
Does anybody want to ask any questions?
I have one, Trish.
Uh-huh.
I have one. What happens to me is I get coughing fits,
Yeah.
and when I'm coughing, I struggle breathing.
Yeah.
I get very, very breathless. And I was just wondering, is there a rule for that, that helps? Because I get a bit confused. I have to really work hard to try and slow my breathing down.
Yeah. Yeah. Is there anything that you can take that will that soothes the cough? Can you take Linctus or anything?
I have the Oromorph and I have
Okay.
codeine Linctus as well.
Okay.
But when I'm on that, when that happens to me,
Yeah.
it's sort of too late to take it. Do you know what
I understand.
And it's usually due to like a little bit of mucus stuck, between my tonsils, and it's sort of choking me a bit as well.
Do you have a nebulizer?
No,
No.
I don't think they recommend them for pulmonary fibrosis.
Okay, right.
I'm not sure now on that, but no, they never suggested that.
Okay. I suppose this is where I need my colleague, my nice physio colleague. If you don't mind, I'll come back to Tom and see what she would recommend.
That would be great.
I mean, I understand, and I think sometimes when you cough, sometimes your lungs nearly go into a bit of spasm.
Yeah.
And then it's hard then to get the air in because you're actually in a wee bit of spasm.
That's
So
right.
I'll speak to my colleague and I'll get back to you. Amanda would know much more about the mechanics of all that than I would. This is
would
not
be
my
brilliant.
area of expertise at all. That's why I'd ask somebody else to do it for me. But I'll find out for you.
Oh,
Sorry.
that'd be
There's
very
also an element of panic as well,
Yes.
Bishop, when it comes into it, and that just
Yes.
exacerbates the whole thing. I was just going to ask Jerry if he didn't mind, because you talked about fans, if he wouldn't mind sharing what his physio told him about the use of the fan, because it's very interesting and worthwhile hearing. Would you mind, Jerry?
No, my physio who has many years of experience using these fans, they've discovered through various experiments, etc., that the right hand side of your face, that part of your brain, contains the area that controls a lot of your breathing. So his advice was when you put the fan on your face, don't put it straight on.
Oh, put it on the right.
Yeah.
Slightly to the right.
Hello.
And it hits the area of the brain and it fills that area into the brain into thinking that there's more oxygen there than what there is.
That's really interesting,
Yes.
isn't it?
Hello. It definitely does work. I've tried it with the straight on. I've tried it from the right, tried it from the left, and it definitely does. It does work.
You don't mind me asking, is your physio called Paul?
He is, yes.
He's brilliant.
Oh, it's fantastic.
He is brilliant. He's done lots of research. He's like the guru nearly, isn't he?
Yeah, he's really clued in.
Yeah.
Well, it was Paul that told us about these experiments which they had done with the fan.
That's interesting. If we're ever looking advice, that's who I go to.
Oh, no better man.
No, that's brilliant.
Yeah.
Great. Well, I'll have to tell him now. He's getting good feedback. He'll be all pleased.
Patricia, I use the fan as well, and it does helps a lot.
On the right hand.
And I do the same as Jerry says, is start on the right hand side.
That's brilliant. That's great to know. I wasn't aware of that. I've learned. So it's every day is a school day. Learned something new myself. So that's really good to know.
Yeah. Well, I have tried it and it does work. It really does. It does help a lot.
We're wonderfully made, aren't we?
Yeah.
You know. There we go. Well, here. Anybody else any questions?
No.
I'll take my leave if that's all right then.
I just like to say, Trish, thanks very much for today. And I love your hair.
Oh,
your hair is gorgeous.
I tell you, the only reason my hair's like is I hand my husband the kitchen scissors every now and again and say, take a whack off that, would you? He took a whack off my hair last night and I can't now get it into a bobble, which is why it's hanging around I don't really like my hair